I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Attention deficit hyperactivity disorder affects millions of Americans, and its diagnosis can be scary and its symptoms a challenge for parents and children. However, treatment is available and can make the difference in children growing up with ADHD to be normal adults. Our guest today is Amanda Schuh. She is a mental health nurse practitioner at Mayo Clinic Health System. Amanda, thanks for joining us today.
Thank you so much for having me.
Well, before we start with today's topic of ADHD, let's talk a little bit about you. You are a nurse practitioner in the behavioral health department at Mayo. What is the difference between what you do and a psychiatrist or a psychologist?
That's a good question. Well, I was trained as a registered nurse, so that's my background in training. And then I went for advanced training for psychiatry and mental health. And I can assess, diagnose, treat, similar to psychiatrist. I can also prescribe medications, and I can also provide therapy for families.
Well, today we're talking about ADHD. First of all, what exactly is ADHD? I explained the acronym. It's Attention Deficit Hyperactivity Disorder. But what is ADHD, and is it different from ADD, which I've heard a while back, I heard that it was called ADD, but ADHD, what is it?
Absolutely. It used to be called ADD, and now we refer to the similar thing of ADHD. And that is a change in terminology that we find better captures what are the symptoms of ADHD. We know that it is a chronic condition. It does affect millions of children as well as some adults. It can have symptoms related to primarily inattentive type. They can be primarily hyperactive impulsive or a combination of both types. They can affect young, old, male, female. It can also lead to disruptions for children if they're functioning at home as well as school, and can also have other symptoms such as low self-esteem or difficulty making friends.
Is there a certain age that it can start or that it typically starts?
Well, we usually find symptoms that start usually at preschool or kindergarten when children start to get into school in more of those structured environments, and that's when we first start to see problems and difficulties.
All right, so you mentioned the three types: predominantly inattentive, predominantly hyperactive, impulsive, and the combined type. Let's start with the first one. What are some of the symptoms of the predominantly inattentive type?
Absolutely. The predominantly inattentive type is more of feels like children are not paying attention. They can over-focus on things that they really enjoy and they really like, while on the other hand, seem not to focus or pay attention to things that they might not like, such as chores at home or possibly schoolwork, homework, have trouble with maybe procrastinating, completing homework, tasks at home. Also may have difficulty with being distracted, being forgetful, and losing certain things that they may need, such as, books or their pens, papers, even their toys at home.
How about the second type? What are the symptoms of hyperactive impulsive? Are they different from the first?
Just like it sounds, hyperactive, full of energy, restless, has difficulty sitting still. Also maybe impulsive, such as blurting out answers to things. Even at school, difficulty standing in line, waiting for their own turn. For some children, they may also, with this type, have some trouble with hitting others or some aggressive behavior, as well as really having trouble controlling some of their urges.
And the combined type, I'm assuming that's a combination of the two.
Absolutely. A little bit of a combination of those different symptoms, absolutely.
Is there one that's more prevalent than the others?
Yep, it is more common for the hyperactive, the impulsive type. We often see that a lot. It can cause more disruptions, which means that the inattentive type can be also difficult to diagnose and to treat and really to find that for some children.
A diagnosis of ADHD, the symptoms that you're talking about, you're saying may do this, may do this. So it's not a one-size-fits-all.
Absolutely, absolutely. And what's important to know is that many children can have some of these symptoms, but what may be different than other children their age, or may be out of the norm for their age group and their developmental level.
All right, so I have to be honest with you. A lot of the symptoms that you've talked about sounds just the way that some healthy kids sometimes behave. Easily distracted, forgetful, seems not to listen, restless, lots of energy. Kids have lots of energy. When should a parent suspect that it might actually be ADHD, and what should they do?
Absolutely. Many children are similar like that, and they can go through phases. And when it starts to become a problem of some of these symptoms, such as having trouble at school, having trouble with making friends, completing homework, and even having trouble at home as well. So one of the important things that we watch out for is how long has this been happening? And we often look at least 6 months consistently of many of these symptoms that may be occurring. And we do want to make sure that we do have the right diagnosis to start off with before we jump into treatment.
So what should a parent do? They've seen that consistent inattentive or hyperactive impulsive behavior, and it's affecting the quality of life of their child. What should they do?
Well, I would recommend that they first start with their medical professional, their pediatrician, their primary care provider, and start with that to make sure there's no other medical causes that may be causing some of these symptoms. And we always want to make sure we do a medical exam and rule out any other similar diagnoses.
And then from there, their primary care provider will more than likely refer them on to someone like you in behavioral health.
Absolutely. We want to make sure that we have the right diagnosis, and we'll go through an assessment and make sure that it really is ADHD.
So what causes ADHD?
That's a great question. Unfortunately, we don't really know specifically what causes ADHD, but we do know some things that may be associated with it. We do know that many children, they think differently. Their brains are literally wired differently. The structures may be different. And some children are a higher risk of ADHD, such as if during pregnancy their mom possibly used drugs, alcohol, if they had exposure to certain toxins, for example, lead paint, and also premature birth and during childhood, some childhood exposure to toxins. Those have been associated with causing ADHD and being related to the diagnosis.
Is it hereditary?
Absolutely. We do know it is hereditary. It runs in families. And we do know that it doesn't mean that your child is not intelligent, or they just don't listen, or you as a parent are not disciplining them correctly. It really is a biological disease and diagnosis.
So how do you treat ADHD?
With ADHD, we can start with medications. We do have many medications that work very well for treating some of the symptoms of ADHD. We also make sure that we include behavioral changes at home and at school, and the combination there is something that does work best for the children.
So what would be an example of a behavioral change?
Good question. We would want to know, how are they sleeping? How are they acting in school? And at home for sleeping, for example, we would want to know what is their schedule, and maybe we can change that schedule. We could also work with the parents on certain types of reward systems of getting the homework done or completing things, or if they're distracted, what other things could you use versus negative reinforcement.
So I take my child to my family doctor who believes my child might have ADHD. We're referred to you in the behavioral health department. What should we expect?
The first thing I would like to do is to, of course, get to know the child and the parents a little better, and that would include asking a variety of different questions. And some of those questions would be, when did the parents start to notice these symptoms? Was it sudden? Was there a certain trigger? Also more about when these symptoms occur. Is it just at home, just at school? Then we would want to, again, gather more information from possibly the teachers. We would ask them how the child is doing at school. Also want to know more about, does anything make these symptoms better? Does anything make them worse? And more, again, about, we talked about sleep schedule with the child. How is that at home? How is the environment at home? And what are some of those things that can be causing some trouble?
So there isn't a blood test or an x-ray that you can do for ADHD?
Unfortunately, there is no single test for ADHD. We do have a lot of good measures and assessments where we can have parents fill out, teachers fill out, and that helps us narrow down some of the symptoms.
So do you believe that medication is the answer, or is therapy and certain skills training better, or is it a combination of all of them?
What we do know from research and clinical experience is that a combination of both medication as well as behavioral changes does have the best outcomes. The medications that we use we have a lot of good data, information, research that they work very well for children.
How about alternative methods like special diets, vitamins, and supplements?
A lot of parents do ask about that. What are other options, other things to try first other than medications? Unfortunately, some of the research that we have about certain diets or with certain vitamins or supplements, they're not strong enough to have a cause of this helps ADHD symptoms or not.
What about things like drinking lots of soda, which has caffeine and sugar, those
Absolutely.
kind of things? Can those things make ADHD more pronounced, or does it have nothing to do at all with it?
And that's another good question. That would be another one of the things I would want to ask the children and the families of how much caffeine do you drink? Do you drink energy drinks? How is your appetite? How is your sleep? Because caffeine, we know, can affect our sleep and our schedule, as well as possibly some of those symptoms, which may make ADHD more difficult.
So what advice do you have for parents for dealing with a child who has ADHD?
This can be difficult for the parents, the children, as well as the rest of the family, unfortunately. But important thing to know is that there is support out there. There are a lot of good support groups. Often local schools have information for parents, other supports. Teachers are a really good resource for parents of how to support them, what are some things they could try at home that are being tried at school. Also can reach out to other parents that may be going through the same thing. Really to be patient with yourself and to also spend happy time with your children.
Now, another question for you. We are in a high-tech world, high-tech society. Kids have access to video games, phones, smartphones, lots of screen time. Does that have any effect on or any connection with ADHD?
More research is coming out trying to understand, is there a connection between more of the screen time when children are younger, the TV, the video games, as well as does it make symptoms worse for those who do have ADHD? We can make some connections, but our world is changing, trying to understand what the connection really is with some of those different things that are changing, things that are vying for our attention and making it difficult to focus and concentrate.
One of the symptoms of ADHD, focusing on something and not appropriate sleep patterns. Kids that stay up late playing video games till 1, 2 in the morning may or may not be a symptom, right?
Absolutely, yep. And that's more of understanding what's typical for that child. Are they able to function at school? Are they having other trouble, difficulty other than playing video games, staying up late?
Another question for you, autism and ADHD. Is there a connection, and what's the difference between the two?
With some of our changes in our diagnosis of both disorders, that we know that ADHD and autism spectrum are two different diagnoses, but they can also occur at the same time. They are thought to be very different and very separate, but we know that a child who is on the autism spectrum may also have ADHD.
Autism, we could do a whole nother show on
Of
autism,
course.
but for folks that don't know, what exactly is autism and how does it compare to ADHD?
Autism or autism spectrum disorder, there's a range now of the different symptoms that can occur for children. It's often a developmental disorder, and it can cause impairments again in school and at home, relating to others. Also some difficulty with completing tasks, focusing, paying attention, in comparison to ADHD, which again can affect children of any age, and we do know that that is a different treatment than autism spectrum disorder.
So how do you, as a behavioral health provider, how do you determine which is autism and which is ADHD? Because they do sound very similar.
Absolutely. And that's, again, more information from the parents if the child met developmental milestones on time, if there were other struggles and other symptoms that we may not be fitting all of the ADHD symptoms. And we also want to rule out any other mental health diagnoses and medical diagnoses which may also be occurring.
You know, we've been primarily talking about children and ADHD. What about adults who have ADHD? What help is there out there for adults?
Absolutely. We know that some children with ADHD, some do grow out of it, and after good treatment, they get better, but some of those symptoms do persist into adulthood. If I have adults that come into my clinic and they're concerned about focus, concentration, some of these other symptoms of ADHD, again, I would ask more similar questions of when they started, how long it's been happening, does it affect your work, your school, home performance, and really go down and go through that assessment as well.
So it's very, very similar between the two.
Absolutely. And the treatment is also fairly similar as well.
All right. Well, unfortunately, we are all out of time, but I'd like to thank our guest today, Amanda Schuh, Mental Health Nurse Practitioner with Mayo Clinic Health System. Thank you for joining us today on Speaking of Health.
Thank you so much for having me.
Have a great day, everyone, and be healthy.